working organization. So let me welcome Mr. Muralidharan for today. Thank you.
Okay, thank you, Madam Vinodini, and good afternoon to all. And it's great to see all the professionals to participate to this webinar. Okay, without further delay, I would like to introduce my topic for today. It's about updated roles and significance of in-house occupational physiotherapy in industrial sector. Okay, before I move on to introduction, I just want to basically explain the topic. Okay, what about updated and significance? Okay, updated is about from physiotherapy perspective, we are continuously updating knowledge via evidence-based and researching. So we are continuously implementing latest approaches in different fields to get the best outcome out of it. For in this case, I'll be focusing more into my musculoskeletal strength in occupational health. Okay, other than that, significance, I think most of you have gone through a physiotherapy management or been a part of a physiotherapy team and so on. So here it's just going to be the second aspect is going to be re-emphasizing the role and the benefit of in-house physiotherapy in getting the best outcome out of it. Okay, why? What's the difference between physiotherapy and occupational physiotherapy? Okay, I would like to clarify this. Physiotherapy, we deal with mainly on musculoskeletal, neurology, and cardiovascular in aspects of physical and to an extent of psychosocial. So when we implement this exercise in promoting health and well-being in work environment, so we call as occupational health physiotherapist.
Your
And
hand is closed.
come again? Okay, so here I'll be focusing more on industrial sector because as all of us are aware, this is the sector where high physical demand is needed and majority of acute musculoskeletal injuries are happening. And so as a physiotherapist, how I can work with the occupational professionals in occupational setup, and also how to be a frontliner to manage the acute management. So it's all about the topic today. Let me move to the introduction. Okay. So here, this graph I got it from Department of Occupational Safety and Health and also SOCSO for the annual report. I just got it from 2005 to 2007. I didn't find the latest update up to 2021. Anyhow, up to 2017, we have two variables here, musculoskeletal disease and noise-induced hearing. So don't focus on the red dots, let's focus on the blue, which is musculoskeletal disease. So this graph obviously shows the continuously and quite significant increase of musculoskeletal disease in a working environment. So this increase of cases obviously going to increase cost of management or rehabilitation or setting up a new technology of ergonomics and all. Secondly, is going to reduce workforce productivity. Third is going to cause continuous re-injury and reoccurrence of symptoms, musculoskeletal symptoms. Greatly going to contribute to psychosocial impact. Of course, lastly, reduce quality of life, not in just in the industrial, but also outside when you are back to your personal life. So, as a physiotherapist, since we are specialized into musculoskeletal strength, we will play an important role to identify what are the threats. And I do understand there's a lot of other contributing factors, other internal external contributors that can cause increase of this musculoskeletal disease. But from physiotherapy perspective, we'll be focusing more on identifying the threats that causes in the aspect of biopsychosocial, which means physical, psychological, and social. Okay, let's go to the content. Okay, today I basically going to talk about three things: occupational health role in industrial sector, how important we are in occupational health, and also possible strategies to implement in-house occupational health in industrial setting. Okay, let me start with preventive measures. We play an important and always a common role in preventing measures. Number one, let me introduce about pre-employment physical assessment. I understand that there are assessment done, but mainly on employee that returning from injury. So the common way of evaluating this is whoever from injury they come back to work, there will be a functional capacity test. Okay, I will speak more about functional capacity test later. But basically, FCT is mainly to evaluate physical strength, cardiovascular fitness, flexibility, balancing, and etc. So we use this tool to evaluate whether they can cope up with the same work or need to modify the task. So these are the, if I'm not mistaken, commonly practiced. But there are other approach that commonly practice, and there's a lot of evidence about it in overseas and Western countries where they do pre-employment physical assessment as early as recruitment itself. So when you recruit somebody, you other than the medical assessment, they do involve physical assessment as compulsory. Because here we are not trying to penalizing or looking down on their fitness level or what, but we are doing early detection, so then we can try to help them to cope up with certain type of work. So here we still can use the function capacity test, which is valid to evaluate their strength, their endurance, the balance, the posture, how the cardiovascular fitness and all. In order, number one, to choose the right candidate. What I mean by choose the right candidate, it's not about choosing whether the most fittest or less fittest, but getting the right candidate for the certain task. If a person need carry a 5 kilo box from down to up, so you need to find the right person after this assessment, whether they can cope up with type of exercise. If not, then further planning need to be done during the orientation period. Secondly, from this early employment physical assessment, we can identify the risk as early as possible. For example, somebody comes with what they call upper cross syndrome. In lame term, is a protruded neck with a rounder shoulder. So we will identify as early as possible, and there could be there will be a long-term effect that can cause further neck injuries and shoulder impingement or spine problem and so on. So we can identify them earlier, then we can start the rehabilitation as soon as possible, so that they don't end up with subacute or chronic stages. Thirdly, reduce injuries. From this method, we will able to reduce injuries, because we are not only guiding them according to the work-related jobs, work-related tasks, but also how to self-rehab and be self-conscious about their physical fitness, even out from the home setting, out from the industrial or occupational setting. So in conclusion, it's a good way that could be recommended, where you can allocate an employee or somebody of suitable job tasks. Or secondly, if they still need to do the certain tasks, although they don't have the proper fitness, we still can start with early prevention, conditioning them, start a rehab, and make sure they're able to do that certain type of job. Okay, second part is early prevention and re-injury management. Okay, here, let me get the, okay, injury, sorry. Need the highlighter, okay. So injury usually happens by two factors. One, by movement that causes injury. It could be sudden, repetitive, cumulative, or overuse type of movement that can cause injury. Secondly, pathological related. It could be, for example, rheumatoid arthritis or neurological or osteoporosis and so on. So here my main emphasis will be on movement, movement related injuries. If in future I got opportunity, maybe I'll talk about the pathology type. Okay, the issue here is when there is an injury, sometimes we don't feel it, but we probably feel some discomfort at this area. Some a small discomfort or not significant enough to reduce your function activities, but you will feel some discomfort, some nagging feelings and all. Most of the time, we will neglect this part and keep do the certain task, or sometimes we just take a temporary pain killer and so on. What happens, this will increase the pain experiences. From the discomfort, it's going to be a dull pain. From dull pain, it's going to be a throbbing pain. From throbbing pain, there's going to be intense pain, then more severe and higher irritability of pain. So commonly, so this part is commonly what happens lah in any occupational setting or particularly industrial. This pain start to catastrophizing, means when the pain is more or severe and is significant enough to restrict your functional activities. That's where we will try to get some attention. The first attention we will find for is the easiest way to reduce symptoms immediately. For example, painkiller, as easy as that. But what happening here, you only controlling or hiding the pain, but you're not solving the problem that contributing to the pain. So what happens here, there are high chances where you get re-injury, because sometimes you must your pain with your painkiller and so on. You won't know for next time how the re-injuries or how many times of re-injury happens or repetitive thing happens. So the high chances of re-injury happens that causes fear of movement. Okay, the problem with this stage, fear of movement, when you have pain, you will fear to move because you already experience a very bad experience of the symptom. So you don't want to move or you reduce moving. So what happens from reducing moving? You're going to cause muscle imbalances. There are some muscles going to be weak. There are some muscles going to be so tight. There are muscles going to be lose the balancing property. So what's going to happen at the next stage? You will try to avoid or try to escape from doing some certain jobs that you could do. You always will undermine yourself to do very simple and not challenging yourself. Here, another stage of problem happens where there will be a deterioration of metabolic rate, cardiovascular disease, cardiovascular fitness, your motor control stimulation, and further muscle deconditioning. Okay, so when this process go on with disuse, here is where it's a risky place where you always end up with faulty belief or disability and depression, where psychological factor significantly influence. And most of the time we call this chronic pain. So chronic pain is more costly and more difficult to treat because it's always associated with psychological influences. So, so this is what commonly happens, or most of the time happens. So what we are trying to do here, we want to prevent this as early as possible, manage it. Whenever they already have some certain of discomfort, we want to identify it and we want to find the contributing factor, whether the work demand is causing that, or environment factor is causing that, or even their muscle imbalances or dysfunction is causing that. So we want to deal this as early as possible before they have any intense pain. In some cases, they will have some certain of pain, and we still allow lower than 3 out of 10 for the pain scale for them to do basic activities or these external activities. Because sometimes it's very difficult to bring the pain to zero. So although they have some little of pain or discomfort, we still rehab them, actively rehab, educate them what's the right movements of doing without aggravating the symptoms. What are the do's? What are the don'ts? What are self-rehabilitation exercises and precautions they have to take in working setting, and also external setting like at home, or they're going for their sport activities and leisures, because most of the time the external factors influence their physical deterioration at most of the time. Okay, so here confrontation, uh, we will re-evaluate, we will recheck, we will re-educate. So the important is we want them from dependent to be self-independent. That means they should know what they're going through. They should know what the pain is. They should know how to solve the problem almost by themselves. Okay, so that's our goal to get the recovery. Okay, so this is a basic. Then we have a very specific training regarding of this, which I will introduce later. Okay, then the second role is about physiotherapy clinical assessment. Okay, here I just got a very simple assessment tool. Actually, it's not so detailed, but I just show you some important aspect that we look for. So under physical assessment, we will be focusing on the history, present and past history, including how the mechanism of injury took place, what's the aggravating and easing factor. Remember, before the slide, we will educate them what's the aggravating easing movement. So then we can we can make them to lose fear of movement. Then how about the 24-hour history, improving the patient history, diagnostic, imaging, and so on. Then followed by posture, which I'll talk further about that later. An examination of active movement and passive movement. This one mainly to evaluate how the strength of the muscle, how flexible is the muscle, whether the joint stiffness present, and so on. And we play a major focus on pain here. This part. Sorry, this part here. So we will identify which area of the pain. Let's say they have a problem with the back, okay? And we will specify what type of pain they are feeling, whether it's a dull pain or dropping pain or it's referring pain or it is radiating pain, because from that, from type of pain, we can rule out what type of structures involved, whether it's still at an early stage or it's getting severe and so on. And also information about sensation will be recorded under this diagram. Followed by this is the isometric movement, is to just check the power of muscle. Functional testing for industrial setting, as I explained before, we focus more on the functional capacity testing. Neurological tests if needed. Some cases with the musculoskeletal cauda or disc prolapse or carpal tunnel syndrome. So for this type of cases, we will check whether there's involvement of neurological aspect. Special tests when needed. Joint play movement to see joint whether it's stiff or there's any limitation in the range of motion and so on. And palpation. Palpation is very important for us because one of the important way to find out whether they having an acute symptom. Acute inflammation usually comes with severe pain, tenderness, warmth, and redness. So we will identify it as early as that and try to do something about it. So in conclusion, what we will derive from the subjective assessment is the first thing will be red flags. These are the one of the most important thing that as a physio we will emphasize, because as far as industrial concern, there will be a lot of trauma or high physical injuries, musculoskeletal injuries will take place. So we can't treat all the cases. So with the assessment, first we will identify whether they are under red flag. If not, then we have other method of ruling out, which I will talk more about it in the next slide. Secondly, we come to a conclusion whether which stage are they, whether they're in acute, subacute, or chronic. Most of the time in acute, we can deal if it is not under red flag. We still can deal as a frontliner for the pain managements and all. But if it's something to do subacute and chronic, that's where we will need some occupational health professions team roles in. Okay, the third one, from the assessment, we'll be evaluating level of functioning, disability, and health. Okay, the sub aspect of functioning, disability, health is first thing. We will have a basic idea of body structure and functioning. For example, pain, restriction of ROM, tightness, or sensation problem, and all. So we will check whether these symptoms are restricting their daily activity or any activity they require for their job. For example, carrying a box from down to up, sit too long, or standing for prolonged period. We will see whether this body structure function contributing to activity limitation. Then further, whether this activity limitation significantly impairing their social activities, here mainly on job tasks. Okay. The another factor that we will consider here as a physio, contextual factor, which consists of environment factor and personal factor. Here, environment factor usually the other occupational health professions such as safety officers or ergonomics will focus on how the environment setting and how to improvise that. So we probably will give some input from them and we'll see how to train them about. Then personal factor, again, here we have our limitation to put them under any personal factor. But we will try to evaluate whether they have influenced by any psychosocial or psychology problem like negative attitude or withdrawal behavior or depression or stress, overtired and so on thing, or also how his personal life, to that extent. Followed by that, we will with all these three aspects, we will fix what's the realistic goal for the individual to achieve according to requirement of their task, and we will do treatment plan according. So this one will be more to individualize rather than generalize. Okay, so that's why we focus one person. We do whatever treatment plan is necessary, and we will execute it and re-evaluate from time to time whether is giving progression or the condition is worsening. If it's worsening or not progressing, we do reassessment, and if we require, we will put them under red flag and for further medical management or examination. Okay, let me talk a bit of red flag, about flags, sorry. Okay, here I've highlighted about 3 flags: red, yellow, and green. So when an employee referred as a musculoskeletal disorder to a physio, upon assessment, we will have a basic idea whether they fall into red flag or green flag. If they present with some type of severe pain more than 7/10 pain scale, thoracic pain, sometimes radiating to the arm or to the jaw, if there's any progressive neurological deficit such as sudden weakness of lower limb, or sudden numbness of lower limb, that kind of things. And we also see whether they have any bowel or bladder dysfunctions or decontinence, history of cancer, high fever, continuous high fever, sudden loss of weight in last 3 months, any trauma, severe trauma, abnormal vital signs. So we use some of these tools to check whether they are categorized under red flag. If yes, there are some concerning features, so we will send them or refer them for further medical referral, examination, or occupational health physicians. Okay, let's say they don't have any concern, they are clear, they don't have this type of issues. The treatment will go as planned and we will monitor symptoms. At some cases, we will find they have some symptoms of yellow flag, like mental health and psychology problem. This is actually concerning as well, but we still will initiate a treatment. We'll see how they're coping up, because as a physio, we won't be in the we don't have the rights to classify someone under psychology factor. So we try to do the treatment, we execute. If it's improving, that's great. We will go on as treated and monitor symptoms, and obviously, hopefully, they show a good progression. Then the plan of discharge take place. Let's say it doesn't show any improvement, uh, and uh, and we having worsening of condition or other negative psychology problem. We don't directly refer them to any psychology or something like that. We will put them under red flag, which means we refer them back to medical referral. So there they will do the necessary decision how to deal them, maybe need a clinical psychologist or so on. Okay, if you notice, sorry, I didn't show with the, so this the red, green, yellow. Okay, so let's say the treatment goes well, treatment is planned, monitor symptom. Let's say there is some worsening of condition or no progression. So we try to reassess, and we find any of these symptoms present, then we refer them back to red flag and get the further medical examination. So here, although we are dealing with acute management, we are being very careful with diagnosing and furthering our treatment, but not blindly rehabilitating whoever comes in. So we have a very systematic control system to flag them and and uh, and do a proper safe management. Okay. Okay. Third, let's talk about the functional capacity testing. I think most of you have have come across about this testing. So it's basically I just got this diagram for you. Hopefully, it's a bit clear. So there are a few aspects that we evaluate from functional capacity evaluation. So the testing can be done as how the diagram shows in the workplace itself, and mainly it is to evaluate physical strength and endurance, because it depends of job tasks required. If somebody need to be trained for strength, then we have to train according to the strength. If somebody need more endurance to perform some sort of task like repetitions of uh, uh, moving and so on, so we'll focus more on training them endurance. So this evaluation form quite valid and very helpful for physio, occupational physio, to determine what type of treatment plan that we can subscribe according to their job task. Also, it evaluates flexibility, uh, neurodynamics, balance and mobility, and lastly, cardiovascular fitness. So yeah, I think let's go to the next. Okay, next, fourth, our role is also to do a postural, thorough postural assessment. But here, um, we do some assessment, but there are other professionals, occupational health professionals, like ergonomics, safety officers, that they do more in-depth analyzing working nature, job, and also movement. Okay. So what as a physio we'll be looking here is how the posture is within line of gravity, because this is important for us to evaluate um, how the muscles are behaving against the gravity, and whether is making the posture within the line of gravity. So usually this is overlapping, or the physios will be assisting the ergonomics or safety officer maybe to get a better understanding of the posture, the analysis about that. And also identifying the faulty posture. So this one, we probably most of the time will work together with other occupational health professionals to get a better understanding and depth info. So for example, here, let's say we detected when an employee carry a load and stand up, there's an increased back curve, or we call hyperlordotic. So this analysis that properly we will analyze, and also we get from the other occupational professionals. Our main role starts from here, from number 3. We will do the further testing, muscle testing and flexibility, as how I showed about the functional capacity testing and our clinical assessment. So we will play an important role from here in order to find out which muscles are weak, which muscles are tight, which muscles are not controlled. Maybe in this case, properly he has weak glutes and abs, particularly external oblique muscle, tight hamstring, tight iliacus and latissimus dorsi. So, and also poor core control. So this is what we identify, then we will prescribe the necessary therapeutic exercise for them. For example, in this case, since there's a weakness, we focus on strengthening. Since there's a tightness, we will emphasize on the stretching. And since there's poor core control, we will focus on training their core and balancing. Then finally, this is very important, where we reevaluate whether the plan and treatment execution is giving a positive effect to the concerned person or not. So if it is not, again, as I explained before, we have to keep reflect why it's not improving. What is there any other cause? What other contributing factor? So we will keep reflect and reevaluate. And also the last part is self-rehab, as I explained before. This is one of the most important things, where the employee should know about their own posture awareness, what muscles are causing them to be faulty posture, how to do their own training, and what the benefit you're going to get, and pros and cons. For example, here, outcome measures, home exercises. Okay, I think I have included some importance under the role of physio previously. So here I'm just going to explain a bit in summary. We play quite a significant role in immediate care, which mainly on acute stage, intermediate care, and extensive care. But I'm not going to talk so much of intermediate care and extensive care, because most of the time, this stage happens from subacute and chronic. And most of the time, they'll be referred to external rehab center or physio center. For example, like Picasso we have in Malacca, that kind of thing. So I'm going to just focus on immediate care. What in-house physio can do immediately to solve the problem and prevent further injuries and maximize their function. Okay, here under immediate care, of course, as I explained, we do the proper clinical assessment, and we see whether they're under any flag. If no, clear, then we go to goals. Here I'm specified whatever goal. Okay, for example, let's say they have any, for example, a person have a sudden back pain after he did a rotation maybe. So he has some discomfort at the back. So we will find out what causing the aggravation of symptom, and we will fix a goal how to minimize symptom by maybe using some pain management modalities. For example, ice, ultrasound, TENS, or if hot needed. Okay, so most of the time, whatever pain management that we are prescribing is actually drug-free. It's more on a natural way of reducing the pain. We have this pain control theory and so on. If I get opportunity next time, I'll be explaining more in detail with that. So we're prescribing more on the natural way of reducing the pain, but we don't stop there. We will proceed how to promote the healing of tissue. So in this case, we're focusing on protection of involved structure. Let's say this person with a back pain, probably for 3 or 4 days, because inflammation usually be there for 3 or 4 days. as early as 4 day or even as early as the same day, we still can move them. But we use some protection so that we allow the healing process take place without any break in between. At least for 3 or 4 days, depending what type of problem, we need allow the healing process take place without any disturbance. That's why we use protection. Yes, of course, it's more passive. A lot of people think it's going to decondition muscles and all, but it's not good for so long. It's just go for, just for the early stage to control the pain, not to aggravate. But meanwhile, in that phase, we will educate them the correct muscle pattern without aggravating the symptoms and what the do's and don'ts by introducing them corrective exercises. Corrective exercise means, for example, for this person, we have find out that they have weakness of glutes and abs. So even standing up, you need to stand up correctly. Okay. So for example, when asked him to stand up, we will give cues that when you stand up, at the end of the standing, you have to contract your glutes, you have to tuck in your abs. So this way, the muscles will be more continuously conditioned, even they are going through some acute level of pain. Okay. So next, with this method, we will maximize function because we don't want them to rest. With the by seeing how intense the pain lah. But we try our best not to make them rest because that will aggravate further the problem. Because that will cause deconditioning and so on and so on. So we want to make them move as long as possible and do some basic function where it doesn't aggravate the current symptoms. So there'll be a lot of education or safe range of movement, and this will be done under supervision of the physiotherapist, where we will check the movement, we will see how the muscles activation and how's the flexibility of muscle, how's the control, and so on. Last but not least, again, we will be greatly emphasize for them to self-rehab. It doesn't mean they do rehabilitation at home. They will recover fully. They have to do what been taught, and they have to keep in mind what precautions that been taught, even outside or at home, and so on. So here, with some self-lock prescription home exercises will be given, also be monitored whether they have done the exercises and all. But it is a bit difficult because we can't be seeing them at home and all. But I believe, with my experience, once we give enough knowledge, pros and cons, what's the potential long-term effect, a proper awareness program to them, they usually will commit to self-rehab and do what are necessary stuff. Okay. Okay. So eventually, the setup, first thing, to reduce disuse, atrophy, and deconditioning, we need to understand here that muscle plays an important role to absorb whatever loads coming down to the joints, soft tissues, and all. So the more you decondition, the more muscle mass will lose, the more decondition the muscles, the more loads will go to the other soft tissues such as ligaments and capsules and joints. Okay, this is not good. Long term, they will develop so many other re-injuries and other conditions like osteoarthritis, impingements, and so on. Second, maintain mobility as early as possible. I think I've explained enough about that. Then third, speed up back to work. Yes, there's a very good program that already there in occupational health, where they do a great job by assessing them using the functional capacity and doing the work hardening and all. So we will try to play a small part by making the acute cases to be healed fast and at least help them to make the back to work to be even faster. Then that, this is very important. We're very much concerned that we reduce all these acute cases to promote into subacute and chronic stages. As how I explained before, in the chronic stages, a lot of psychology influence will be there, and it's usually very costly and more difficult to treat. And I have a diagram after this that will show you overview about the chronic stages. Okay, last but not least, yes, cost saving. Because if you can control the acute symptoms as early as possible and make them to move with a with a less amount of pain and make them contribute to function with self rehab, of course you don't need a long term cost spending, both from the individual employee and also the management, and also from the Pekeso insurance claim. Okay, so these are the just the overview of that, where the early intervention, how is cost saving. Okay, here, as I explained before, usually the injury comes with a mild discomfort, right? Okay, so we still have some area here, at least moderate soreness or mild discomfort. And here, you just need a little amount of treatment or therapeutic exercises where you just can reverse it and condition it to an extent. So if you let it go, it's going to turn into constant aching pain, stiffness, where this one going to significantly affect your function activities. To make it worse, constant nagging pain, where you can't do much movement and you have this fearness and also so anything. So here, there's more time needed. The more time you spend for treatment, the more money you need to spend. So that's how it works. Okay. So you need more because you need to include pain relief techniques, because there's a lot of equipments out there now where it's quite costly. So if we don't focus here much, then we have to bear this. To make it worse, if you is already in chronic pain, that's where you see. But because when in chronic pain, there's a lot of psychology influence, and sometimes the physical rehab, you don't believe in physical exercises and all. You try to find shortcuts to get ease the pain. So you probably will go traditional medicine, or a lot of drugs. You use a lot of drugs, and you need to spend a lot of money for your consultation. Probably you need to go for surgery, and so on. So there's a lot of money need to come out. The more doctor visits, the more work restriction. You're not going to get proper paid. All these things will come in. So when you compare to the cost, so I think you can clearly see from this part where the early stages obviously low cost, and you can commit to some light duty even with the constant ache stiffness. This is what I've explained just now. And the more you go, the more problem you're going to get. You're going to get more loss of productivity, high medication use, more absenteeism, lower moral support, psychology issues, depression, stress, and so on. And here going to be more worse, where you probably classify under disabled, going to go for more claims. Healthcare expenses are going to increase, not just by the physical treatment, but going to be from drugs, constant visit to hospitals, other alternative treatments, and so on. Okay, so I hope you understand well from the importance of the early intervention, and we treat as soon as possible before we proceed to chronic and so on. Okay, strategies implement in-house physiotherapy industrial setting. I just come up with two for now. The first one is on-site physiotherapy setup. Of course, this is the main thing that we're emphasizing. And actually, if I'm not mistaken, there are few industrial here. That's why I know there is in Nestle company where they have a in-house physio setup. So this is quite useful as one of the roles and benefits I told, when the physio is there and able to attend you as soon as possible, and making sure there's less re-injuries and prevention. So, and it's not as easy as that. Okay, during the step of implementation, because so far, if for our country, we don't have any regulation or law for this. Compare with other Western countries, they have their registration and law that that to have in-house physio setups and all. So here, the strength, I'll talk about strength first. You get to easily visit the job site. The physio will be there. We probably will be the frontliner, assisting the other healthcare occupational health professionals, and we can give aid, proper first aid acute care. I think I've explained in depth how we classify them under red flags and make sure them they are on the safe side of doing the treatment. Then better understanding of job requirement. When we are there, we need to understand there's a lot of difference to train them at the outside setting. For example, in a clinic or in a rehab center, that surrounding is not going to be the same as in the job they are doing. Obviously, no one change. So anyhow, it's very difficult to match it. So this will be a huge challenge that we want to rectify. Because most of the time you have to treat according to job requirement. Okay, and I understand that like ergonomics and safety officers plays an important role here and adjusting their movement analysis and all. Then next, individualized assessment and treatment plan. I think I've explained enough the importance of this. So we can do the assessment and we can plan quite in detail. Supervised treatment, yes, we'll be there and we make sure that even in acute care, the pain doesn't aggravated, is preserved, protected well, and still do movement optimally. And last one, of course, cost effective and time saving. I think this is explained enough. But we have challenges. The first challenges, of course, I have to reflect back to my own profession, which is there's not much competent occupational health physiotherapists because we always in an external factor where we work in a physio center or rehab center and we treat them from there, and not much exposure those physio that works in the industrial or corporate to highlight their job tasks and treat them according to the job requirement. So this is something that we really need to ponder, and I have a huge interest to involve myself and improve my knowledge into occupational health. Second, budget allocation for in-house rehabilitation. Yes, this is a big problem because at this current situation, it's not easy to set up a physio house, a physio setup in industrial or corporate. So this still a big issue that we need to think about it, where I got highlight in opportunity. Awareness significant of OH physiotherapy management. Okay, so this is another challenge where I feel that very less awareness about the role of occupational physiotherapy. So I'm glad that I took a step today that talk about and just give some awareness, and hopefully I can work together with other occupational professionals, and also I'd be very glad to hear some feedback how possible this type of implementation to take place. Lack of national level evidence researchers, yes, I strongly agree. Compare with ergonomics or social occupational safety in physio perspective in regarding of work-related musculoskeletal injuries, very poor. And hopefully in coming times, more researches to be done to prove our effectiveness. Okay, what opportunities? Maybe if we get if any factory industrial got a chance to have a setup, maybe we can refer back to the framework for other international country, how they set up occupational physio in house. Maybe a second, Pekeso insurance company involvement for budget location. Maybe it's difficult for them to set up the center, so that's probably not going to happen. But how we can approach is whoever treated in an in-house physio center properly can be claimed under Pekeso or insurance company. So because this is what is happening when the employee go out of the center, they still get claimed by Pekeso or insurance companies and all. So it would be a good suggestion or opportunity if we can liaise with these insurance and Pekeso companies where they can do the claiming. And so there's be a less burden, financial burden for the management or to the company or industry. Ongoing research and development to monitor improvement and cost saving. Yes, if we get this opportunity, we can start the research development, how far is improving, whether it's giving a good positive effect, whether it's significantly increasing musculoskeletal diseases, along assisting other occupational health professionals. Okay. The second one, this is what the commonly is being done nowadays, which is continuous training and follow-ups. Okay, but due to this COVID and the MCO, I think past 2 years things are not going so big. Hopefully, we will look forward to get some in-house training. You see, I've done a lot of training. And we actually, I'm actually assisting, working and assisting Madam Vinodini from physiotherapist perspective for this course, this particular course, where it's about early self-pain management techniques for work-related musculoskeletal disorders. So for the webinar today, you probably have a better, you probably have a good understanding how important early prevention and early self-pain management. So it's a very nicely structured well by Madam Vinodini, and it's a very good course where it's HRDF member under SPL CAS. So hopefully we will go along and get this training kick off well, and creating more awareness and try our best to reduce what it calls try to improve productivity, cost effectiveness, and so on. In conclusion, as simple as that, we already have ergonomics, the safety factor, and the other occupational health and professions and all. We want work together as an active team member or frontliner, assisting the other occupational health professionals, mainly first, to cost saving to employers. Second, to decrease potential or future work-related musculoskeletal disorders. Increase productivity of workforce. Not forgetting, make faster return to work for employees. And finally, decrease absenteeism. So I hope I've covered as much as possible, and that's all from me. So, is there any question?
Yes, thank you so much, Mr. Murali. Thank you so much. I'm extremely happy that you have brought up this topic, and to make a lot of practitioners over here today to understand the importance of industrial physiotherapists, and how we can help as a physiotherapist, how we can help the industry to reduce the musculoskeletal cases, which from your statistic we have seen that MSD is actually increasing day by day.
Yeah.
And the cost of treating MSD is not very less. It's quite huge amount of money. Example, if we treat a back pain in an earlier stage, we only going to spend 100 or 200 ringgit. Yeah. But if the same condition, if you're going to treat them in a very late stage, let's say the worker, started to develop this prolapse or something, it's going to cost at least 10,000 or 20,000 or more than that, and not only the cost, it also going to affect the functional ability of the worker. So it's extremely important, for person like us, to come in front. Before these physiotherapists, we always come behind as a backhand in a rehabilitation center. But industrial physiotherapists, we coming up with a new avatar of coming in front as a frontliner at early, so that we can prevent them, identifying the worker as early as possible and preventing them as early as possible. So thank you so much, Mr. Murali. But we do have some questions from the floor. Okay. The first question is, do you provide a report back to the GP, general practitioner, or OHD, occupational health doctor, regarding your findings when an assessment is done for an employee? I think for this question, maybe on behalf of Mr. Murali, maybe I can answer. Is it okay, Mr. Murali?
Yeah, okay, get in.
Yes, for this, yes, doctor. Actually, after we come out with the report, especially for functional capacity evaluation or testing, definitely our report will be given because we do have our occupational health doctor in our company. So it will be, will be double checked and will be endorsed by OHD doctor regarding our assessment. Let's say in our findings, we had identified that the particular worker need to be seen a doctor or any as to take seeing a general practitioner as soon as possible. We also make sure the worker will be get referred to the to the particular doctor. Okay, thank you, sir. Thank you, doctor, for your question. And Mr. Murali, we do have another one question.
Okay.
What are the recommended physio sessions required for an employee complaining of backache? If organic cause has been ruled out.
Okay.
What are the recommended physio sessions? Yes, I think Mr. Murali will be the best person to answer this.
Okay. Here, again, as how I explained in the slides, we have to do individualized assessment steps to rule out what are the contributing factor. Because it's easy to treat the symptoms, but it is challenging to find the root cause and find from it whether the muscles giving the problem, muscle dysfunction is a cause, or is a core problem and all. So I'm sorry that I cannot prescribe any specific goal or treatment for now. But basically, what we will do here is initially we will assess whatever pain, classify them, whether it's is in acute or subacute. Then, with other postural muscle testing and flexibility, we will see which muscles need to be readjusted, retuned, or reactivated. Then come up with a plan. And also, usually, we will give 6 weeks of timing, 6 weeks program, 1 week probably two to three times. The reason why 6 weeks, because our adaptation take place at least from 1 month to 1.5 months. So when at the early stage, when we guide them, they will be dependent on us, on the physio. Second, we will try them do themselves, and we will supervise them. Third stage, we let them do, and we will evaluate. The last stage, they will do themselves by automatic. So this one take at least 6 weeks, but we will treat the pain as early as possible, and we actively train them along the 6 months, along 6 weeks. Only some cases with chronic problem or with other psychological issues, we probably go another 6 weeks. So it all depends on the condition. So I hope I answered your question, and it was a good question.
Yes, there's another one question for Dr. Arul. Another question is, what is your opinion of providing employee with the light duty advice and what compromises light duty?
Okay, here this is a great question. Okay, here our as a physio, we will emphasize what are the aggravating factor and easing factor. What are the position or what are activities are aggravating the symptoms, and what are the activities of movement that easing their movement. So at the early stage, we will allow them to do movement or activities that easing, while we do the therapeutic exercises and adjustment. Then at the second stage, we will supervise and evaluate while they're doing towards the aggravation, previously aggravation positions. So this is how we will translate from the light to the X. Did I answer your question?
I think Mr. Murali, thank you so much for the answer. But I think what Dr. Arul is asking here is, what is our opinion on providing employee with the light duty advice and what compromises light duty? In sense of, I think if I'm not mistaken, what Dr. Arul is mentioning about is, they are when some particular worker, example, coming back with a severe back surgery, if the particular person not able to return to the normal work,
Okay.
is it okay of giving of advising the particular worker to give to change the particular worker's task to lighter task, light duty. So I think
Okay. Okay.
that's what we always will be advising, right?
Okay.
Yes, doctor. Whenever the particular worker is coming out, actually, whenever they coming out with a particular problem or they come out after surgery, so we will conduct a FCE. That's another one important role of a functional capacity evaluation,
Yeah.
where we will try to evaluate them and to identify if the worker is fit to the particular task or not. If we feel that the worker is not fit to the task, definitely we will try to advise them, we'll advise the employer or the organization to give the worker, some other light duty task or something which the worker can able to perform it without compromising, the worker's condition. Uh, Yes, Mr. Murali, we have another one last question.
Okay.
I think this will be good. I think you will be better person to answer this. What is your opinion of adding physical training during work hours? For example, 30 minutes in a 7 to 8 hours shift. Similar to one that we used to have during our school days. Remember,
Yeah.
before we start our school, we used to have physical training.
Correct.
So, doctor is asking about your opinion on that.
Okay, thanks for the question, but it is highly recommended actually because usually before this, when I was giving training in more to corporate side of setups, we as a physio we always emphasize this part of physical activity in between working hours because however you train a person, however conditioned they are, however well they are, our body is designed to for movement, for activity, is not designed for static position. So how much you train a person, when you are static for more than 40 minutes or 45 minutes, you're going to burden your structure. So it's a great suggestion, at least if possible one day once. There are some companies they are doing before starting work, they'll do like 50 minutes to half an hour of warming up, stretching, some basic activation. And once they finish work, they will redo all the stretching, warming up. It probably going to take 15 to 20 minutes, but I would advise probably can do before working start and after working, because after the 8 hours or 7 hours you work, you have all this tension, tightness and inhibition and all. So once you finish work with some exercises and releasing, your body's function will be better. And why I don't really recommend it in between working hours, because it depends on the organization. If they have, it's difficult to convince them to do some activity in between the working hours. So the best step before starting work, 15 minutes maybe, and after work finish, 15 minutes. That will be a great approach actually.
Yes. So that's all, Mr. Murali. So thank
Okay.
you so much, Mr. Murali, for a great
Thanks.
talk.
Thanks a lot for all the professionals' participation, and thanks a lot for the opportunity. And we also, me and Madam Vinodini also, we are looking forward for other webinars regarding of other aspects, industrial, corporate, where we are focusing more on corporate industrial aspect. So hopefully, I'll get more opportunities to deliver more information regarding from the physiotherapy perspective. So hopefully one day we can kick off this well. Okay, thanks again. Have a good day all.
Yeah, thank you so much. Thanks, everyone. For participants, please don't forget to complete your evaluation for this program. Your feedback will be extremely crucial for us. Thanks again. Thank you so much.
Vanessa, I got something to
Puan Aida?
Okay, thank you, Mr. Murali and Madam Vinotini.
Thanks, Haja. Thanks a lot for the
Thank you, Puan Aja.
arrangement. Thanks a lot.
Thank you everyone for coming. Maybe we can have a photo session. Can everyone turn on the camera? I will snap one or two photo.
1 minute. 1 minute.
Yes, for a while.
Okay, where is it? Okay, so is my face is there?
Definitely your face is there.
I need to stop sharing. Madam Vinotini, can you stop sharing your screen?
Yeah, sure. For a while. I should stop, right? Yes, I stopped it.
Okay, then everyone can on the camera. Okay. Okay, 1, 1, 2, 3. Okay, one more. 1, 2. Okay, that's all. Thank you everyone for coming.
Thank you everyone.
Bye.
Thank you so much. Bye.
Right. So I just leave, huh?
Sir, brother, leave பண்ணாதீங்க. ஒரு கேள்வி வந்திருக்கு. யாருக்கு தான் எனக்கு தெரியல இப்போ.
What do you teach for ergo care and training?
Yes, yes. What do you teach?
Teach under the company ergo care and training.
அது நான் அனுப்பிடுறேன்.
Okay, okay.
Okay, brother, we will stop this. We leave then. We will do a video call, WhatsApp call now. Thank you.